Well, recently the iPhone presented its new iOS 8. How can this help to protect your health?
I think the big advantage would be that people start to become aware of their health. It's so easy to start to assemble your health data, and if you can really see it, it might make you wonder, am I okay? Should I change my lifestyle?
But how do I deliver my data to the iCloud or wherever it is?
I'm not sure. I think it works like all kinds of apps would connect to the Apple Health system, and they are creating a kind of dashboard that integrates this in terms of bringing everything together.
So you have then an app, you look at your daily activities and what you eat, and you get the message, do this and this and this. That's the outcome?
I don't know if Apple provides messages, but there's nothing new here, because Nike and others already have these integrated apps. The interesting point is that Apple now does it, and Apple is big, and Samsung is going to do it too. Yeah, they're also big. So there's a revolution of these applications that now become commonplace. I think that is the fascinating point.
From applications to the more simple things, one of your key messages was that the body must be flexible to tolerate a lot of fat, a lot of sugar. If the body is no more flexible, you are sick or close to be sick. Is this correct?
In general terms, yes. I think that we should redefine health, not from the absence of disease, but as the ability to continuously adapt to changing situations. Then we get closer to what our physiology really means.
But flexibility, does this also mean one person can drink a lot of alcohol and will always stay healthy and the other one will get sick anyway?
Well, then you come to inter-individual differences. And in the case of alcohol, we know that certain people are good in metabolizing ethanol, the biochemistry and the genetics, and others are less good. So that is an interesting example. Same for coffee. I can drink 10 cups of espresso and sleep quietly, and others with a glass of Coke at lunch sleep bad because of the caffeine in there. That is not so much the flexibility part, but the inter-individuality part.
One more question, the fatty liver disease.
Yeah.
You have mentioned that there are some nutrients which could influence this steatosis, this fatty liver disease, which is now so common in obesity.
Yeah, correct.
Do you really believe in single nutrients like choline?
No, what I try to say is that fatty liver is a symptom and can have multiple causes. And if in a specific person the cause is the poor availability of choline, then we should fix that. And behind that there can be a genetic origin. We know this now. It's published. It's known that if you are not able to synthesize choline yourself, you are completely dependent on choline from your meals. So in that case, we should know that, and we should be able to diagnose this and intervene. In the end, we know that in most of the cases, fatty liver has a dietary origin, whether it's calories or fructose or lack of a specific compound. So
this is a rare disease, the choline deficiency.
The genetic choline deficiency is relatively rare, but.
So no good news that you just
but
eat a pill and
there's a study out with adolescents, teenagers, overweight, and by supplementing them with choline, they decrease their obesity and their fatty liver. So apparently there already was not a deficiency, but an inefficient fatty acid oxidation.
Okay.
That was carnitine. I'm mixing up.
That was carnitine.
Yeah, that was carnitine.
With carnitine, it's well established. Choline is.
You know, if there's a very interesting example. If I take a mouse and I starve the mouse, it gets a fatty liver. That is weird. You should think the mouse would get a lean liver. The choline starves before the calories. So before the mouse gets into real problems, already the mouse starts to accumulate the lipids in its liver because choline is missing. And that is a very interesting example.
Do you think in 10 years from now on an app we will have all these fancy tools?
I think it will never be extreme, but I think that there'll be a lot to win in this. Yeah,
okay.
I think.
Thank you. Let's hope.
You're welcome.
Thank you.